That's a filling instead of a crown. Just fix the part that's worn out. That's the fastest recovery of all. Partially. We all will get arthritis, every single one of us, if we live long enough. Every single person will get gray hair, wrinkles, and their cartilage will wear out. If you're 90 years old in the United States, there's about a 90% chance you've already got a hip or a knee replacement. You can have a surgery that's really close to going through a tunnel, walking through, and without stopping, you come out of the other end and you have new cartilage, and you're not sick, you haven't lost a lot of blood, and you haven't been traumatized. That's what our goal is. Computers. Don't measure 10 times and cut once. We're measuring everything continuously while we're working. We're making thousands of measurements, and then we cut once. Real-time data while we're working. While we're putting parts in, we know if they went in correctly. We know if the leg's straight or crooked. We know if it's long or short, and we know the entire time we're operating. Why would you not want a computer in the operating room while you're doing this surgery? Give me one good reason you don't want that computer in there. If the surgeon says, because it took longer, what do you want? You want it to be a few minutes shorter, or do you want it to be done properly the first time?